Hi all, welcome to EJV's online education program. It's about nurses who are preparing for the exams to the Gulf countries like Oman, Saudi, Bahrain, Kuwait, etc. So many of the candidates are having difficulty to study the theory because of the duty timings. They are not able to attend the online live classes or offline classes. And many of them, what they do is that they by heart the materials which they get from the social media and they directly go for the exams. As a result, they are not able to score the proper required score for their exams. For all these problems, we have found a solution, which is EJV's online app. Okay, so mostly the pattern of the question is that there will be a scenario, and below that there will be 4 options, and we have to select the correct answer. So most of them, because of the lack of theory knowledge, they are not able to select the correct answer. Okay, so we are providing a solution for that. In the question discussion section, we not only provide the right answer, we explain about the condition and the rationale of the right answer. Okay, so we have uploaded classes in addition to these question discussions in our app. So it is easily understanding, so that it helps to clear the exams properly and you will score high marks. If you study the materials and the question discussion properly according to our instructions, we assure that you will get the required marks and you will pass easily. Okay, coming to the features of our online app program, it is a 35 hours online class in which there is HD video classes which we have already recorded and uploaded in our app. And second, we also have PDF materials in which there are questions which have come recently for our exams. Okay, and third thing is we have mock test, so that you can practice questions and you can check that how far you have improved your knowledge. And fourth, we have exam mode test, in which you can practice the questions just like how you prepare for your exam or how you attend in the exam center. Okay, so all this helps you to gain knowledge and also to score high marks. Okay, there are some additional features which we provide. First thing is that you will have individual faculty assistance. Whenever you have doubt, you can clear the doubts with your faculty who are available in online, or you can call them and you can clear your doubts. The most important feature of our app is that convenience. You can watch the theory classes according to your time. There is no time frame inside our app, so the duty problem will not be an issue. Whenever you are free, you can watch, and you can watch any number of time you want. Okay, then recently asked questions. We have a WhatsApp group in which we discuss with the students or candidates continuously. We make sure that they are covering the topics properly, and we also provide them recently asked questions given by the previous attended candidates. Okay, and we are daily updating the questions inside our app, so please watch it. If you like this video, like, share and subscribe. Please share it to your friends so that they also get benefit from our app. So these are the facilities we provide. Thank you. So today we are going to discuss 2 important topics which has been asking frequently for all the exams, whether it is DHA, HAD or Prometric. So let's see what are the topics. First topics we are going to discuss is glomerulonephritis. So glomerulonephritis means inflammation of the kidney leading to the damage of glomerular network. So it is an autoimmune infection of the glomerulus. So what is glomerulus? This is an anatomical picture of glomerular network of the kidney. Main function of the glomerular network is filtration, in which the waste products which is in the blood is removed, mainly nitrogenous waste, which is urea, uric acid and blood urea nitrogen. So removal of nitrogenous waste is the first function, and second most importantly, saving the protein or reabsorption of the protein, which is essential for the body. So reabsorption of the protein and removal of waste products are the function of glomerulus. So what happens if there is infection to the glomerular network? So the entire filtration function will be damaged, leading to the accumulation of waste products in the blood and loss of protein through the urine, which is called as proteinuria. So this is what happens in glomerulonephritis. Now let's see what are the important points related to glomerulonephritis. So as I said, definition is it is an autoimmune infection of the glomerulus. Important thing is causative organism, which is group A beta hemolytic streptococcus, which mainly causes infection in the upper respiratory tract and throat. So, second important factor is risk factor, that is previous history of throat infection, because as I said, group A beta streptococcus mainly causes infection in the throat, causing sore throat. So, while collecting history, a nurse should ask the patient about the history of upper respiratory tract infection. So, this is also an important point. What is the main responsibility of a nurse when he or she suspects a patient is having glomerulonephritis? You should collect history about frequency or history of upper respiratory tract infection or throat infection. Let's see what are the clinical features of glomerulonephritis. Clinical features are also most important if you are writing exam. So, first thing is, one of the characteristic features of glomerulonephritis is periorbital edema, which means edema around the eyes. Patient will have edema in the body also, but most importantly, characteristic feature is periorbital edema, which is edema around the eyes. Second feature is uremia. Uremia means increased urea in the blood. So, uremia, which leads to metabolic acidosis. Third feature is hematuria. This one is also important, appearance of urine in the glomerulonephritis. In hematuria, the appearance of urine is smoky and cola colored urine. And fourth clinical feature is proteinuria. As we discussed, protein is lost through the urine, which is called as proteinuria. So, clinical features are periorbital edema, uremia, hematuria and proteinuria. In hematuria, in glomerulonephritis patient will have hematuria and the appearance of urine will be smoky and cola colored. So, these are the clinical features of glomerulonephritis. Next, let us discuss about the management of glomerulonephritis. Most importantly, we give antibiotic penicillin, which is benzadine penicillin. The name of the drug is important. The drug used to treat glomerulonephritis is benzadine penicillin. Second is dietary management, in which you should restrict protein because of excess loss of protein through urine, and restriction of sodium and fluids because patient is having edema. And third, immunosuppressants, as glomerulonephritis is an autoimmune disease, which means hyperactivity of the immune system, you should give immunosuppressants. And fourth, dialysis for chronic glomerulonephritis. A complication of glomerulonephritis is, or a complication of chronic glomerulonephritis is acute renal failure. Due to increased waste products, as I mentioned, due to increased urea and uric acid in the blood, chronic glomerulonephritis can lead to acute renal failure. So, in case of chronic glomerulonephritis, the management is dialysis to remove the excess waste products from the blood. So, the management is benzadine penicillin, restrict protein, sodium and fluids, immunosuppressants, and fourth is dialysis for chronic glomerulonephritis. So, let us see it again from the beginning. Definition of glomerulonephritis is autoimmune infection of the glomerulus or glomerular network. Causative organism is group A beta hemolytic streptococcus. So, risk factor is previous history of throat infection. So, while collecting history, you should ask about history of upper respiratory tract infection. And the clinical features are periorbital edema, uremia, hematuria, in which smoky cola colored urine, and fourth is proteinuria. Management, as we discussed, first is benzadine penicillin, and second restrict protein, sodium and fluids, and third is immunosuppressants, and fourth is dialysis for chronic glomerulonephritis. So, these are the important points related to glomerulonephritis. Now, let us see the second topic. Second topic is nephrotic syndrome, which mainly occur due to glomerulonephritis. Just like we mentioned before, due to the infection in the kidney, the filtration process of the glomerular network will become impaired, leading to proteinuria, and due to proteinuria the body will show a group of symptoms which is known as nephrotic syndrome. So let's see the points of nephrotic syndrome. Definition: a group of kidney disease with unknown cause leading to damage to the nephrons. So kidney cells will be damaged. A group of kidney disease with unknown cause which causes damage to the nephrons. So let's see what happens if a patient is having nephrotic syndrome. Before that, let's see the causes of nephrotic syndrome. First thing, as I said, first cause of nephrotic syndrome is glomerulonephritis, and second is SLE or systemic lupus erythematosus, which is also an autoimmune disease which affects multiple system damage, which mainly causes nephritis also, leading to nephrotic syndrome. And third cause is CA kidney. So three causes are glomerulonephritis, SLE and cancer of the kidney. Now pathophysiology of nephrotic syndrome. We discussed what happens if infection occurs. It will damage the glomerular network, resulting in proteinuria. And what happens when proteinuria occurs? When excess protein is lost through the blood, it leads to decreased level of albumin in the blood, which is called as hypoalbuminemia. Then what happens if hypoalbuminemia occurs? There are two things which happens when hypoalbuminemia occurs. First is decreased oncotic pressure. What is oncotic pressure? The pressure exerted by albumin in the blood. So in blood, you all know that there is plasma, in which albumin is one of the major component. So what is the function of albumin? It applies pressure in the blood so that the fluid inside the blood vessel is retained. Understand? So pressure applied to retain the fluid in the blood is known as oncotic pressure. So due to hypoalbuminemia, the pressure required will be decreased. So there will be decreased oncotic pressure. So because of decreased oncotic pressure, the fluid cannot retain in the blood vessels, and as a result the fluid will be shifted outwards, which means fluid will be shifted to the tissues, leading to excess fluid volume in the tissues, resulting in edema. So I will repeat, decreased albumin leads to decreased oncotic pressure. As a result, fluid cannot retain in the blood vessels. It is shifted outside to the tissues, leading to edema in the tissues. So pathophysiology is decreased oncotic pressure leads to decreased plasma volume, resulting in decreased BP because there is no fluid inside the blood vessels, which leads to increased sodium retention and edema. So one of the important features in the nephrotic syndrome due to proteinuria is hypoalbuminemia. Second is edema. And due to hypoalbuminemia, second thing happens is, to maintain albumin level in the blood, the liver gets activated, and liver produces a protein which is known as lipoprotein, which means lipids plus proteins. So increased lipoproteins will be distributed to the blood, and the body will uses the protein. What is remaining? Lipids. So it will result in increased amount of lipids in the blood, resulting in hyperlipidemia. So another important clinical feature in nephrotic syndrome is hyperlipidemia due to increased lipoprotein by liver. So this is the general pathophysiology. Mainly what happens? Proteinuria resulting in hypoalbuminemia, which leads to edema, and second thing, hyperlipidemia due to increased lipoprotein by the liver. So if you see the clinical features, you can see first thing is proteinuria, and second, because of this, hypoalbuminemia. If hypoalbuminemia, how the albumin, as a result of hypoalbuminemia, or how the hypoalbuminemia occurs? Because excess albumin is lost through urine, which means there is increased amount of albumin in the urine. As a result, the appearance of urine will change, which is foamy urine. So this one is also important. What is the appearance of urine in hypoalbuminemia? Foamy urine due to presence of albumin in the urine. And third, edema resulting in weight gain. Because of fluid volume excess inside the body, the patient will have weight gain. And fourth is hyperlipidemia, just as we discussed, due to increased lipoprotein production by the liver. So four important clinical features of nephrotic syndrome are proteinuria, hypoalbuminemia, edema and hyperlipidemia. So in the management, medical management will give diuretics for edema and corticosteroids. This is most important. Corticosteroids for immunosuppression. So, diuretics for edema and corticosteroids for immunosuppression. In nursing care, first thing is to check weight daily. What is the purpose of checking weight daily? To check the effectiveness of diuretics. So, this is an important question. How should we check the effectiveness of diuretics? In the options there will be urine output and IO chart, but in order to check the effectiveness of diuretics, the most important thing is to assess patient's weight to check whether the edema has been relieved. So, check weight daily. Second is restrict sodium, fluids and lipids. Sodium and fluids should be restricted because of edema, and lipids because patient is having hyperlipidemia. Most important thing in the diet is that give normal protein diet. In glomerulonephritis we said that you should restrict protein, but in nephrotic syndrome you should give normal protein, neither low or high, normal protein is given. And finally, IV albumin for hypoalbuminemia. So, these are the nursing responsibilities: check weight daily, restrict sodium, fluids and lipids, and most importantly give normal protein, and finally IV albumin for hypoalbuminemia. Nephrotic syndrome is a group of kidney disease with unknown cause which causes damage to the nephrons. In clinical features, there are 4 important features: proteinuria, hypoalbuminemia, edema and hyperlipidemia. So, in the management we will give diuretics for edema and corticosteroids for immunosuppression. Important nursing responsibilities are: check weight daily to check the effectiveness of diuretics for edema, and second, restrict sodium, fluids and lipids because patient is having edema and hyperlipidemia, and finally most importantly give normal protein diet and IV albumin for hypoalbuminemia. So, these are the 2 important topics which comes frequently for all the exams. I hope you all understood the class. Thank you.